Now, it is my pleasure to introduce Ms. Sushmita Harish, who will be taking our next two sessions. Sushmita, over to you.
Thank you so much, Ms. Madhira. Hello, everyone. I'm Sushmita Harish, and it's my pleasure to be your host today. We have an important case study session titled Implementation of JCI Safety Recommendations to Address Diagnostic Safety. To take us through this informative case study, I'm privileged to call upon Ms. Rekha Chakrabarti, General Manager and Regional Quality Head, Apollo Hospitals Enterprise Limited, Bengaluru. Madam comes with 2 decades of quality experience upholding patient safety at all times. Over to you, ma'am.
A very good afternoon to one and all. On this occasion of World Patient Safety Day, it gives me an immense pleasure to speak about the diagnostic safety today. And am I audible? Okay, okay. So my name is Rekha Chakrabarti, and I am the Regional Quality Head for Karnataka region and Central region for Apollo Hospitals Group. And this month is celebrated as a World Patient Safety Day. And on the 17th of September, we have all celebrated the Patient Safety Day. So the day marks the worldwide movement of to enhance the global involvement of the patient safety, and it also helps us to involve the patients and the public and their engagement in the patient safety aspects. And the world. 12:40 to 12:55. Okay. Public engagement in the patient safety aspect, and also the we have to work together for the patient solidarity and in the global aspects. So each year there is a campaign on per a theme that the patient safety day is being told that we have to have a kind of a theme that we have to address and we have to follow on. And this year that the theme was related to the patient safety, related to diagnostic improvement and patient safety, and the slogan was "Get it right and make it safe." So what is diagnostic safety? So what is diagnostic safety? As we have heard about a lot of discussions in the previous panel discussion also, so diagnostic safety is all about making the right decisions, and it should be accurate, it should be timely, and it should be patient-centered diagnosis, which helps to prevent any kind of errors, any kind of delays, and any kind of discrepancies that is happening due to the diagnostic test that is being done. So the lack of diagnostic safety that results in the negative impact in terms of the livelihood and the lives of the patients, which increases the mortality, the morbidity, and also it also raises the healthcare costs from the patient side also and from the healthcare perspective as well. So we all know that globally, if we actually counter the total amount or total percentage of the preventable harms due to diagnostic errors is around 16%, and it is mainly dedicated to the delayed, the wrong, and the misdiagnosis that happens, and also due to the failure in communication to the patients at the right time. This creates a huge opportunity for the healthcare organization to improve on the outcomes of the patients, and also to have a kind of a collaborative approach where we can work together to improve on the patient safety. Thereby, patients are at much comfortable level in terms of their outcomes and care delivery. So with so many confounding factors, and coming in the complex care setting of a healthcare system, getting a correct diagnosis and accurate diagnosis all the time may not be possible, and it only takes that we should be able to have a collaborative approach between the patients, the clinicians, the caregivers, and also the healthcare organizations to work together as one team to close the gaps due to diagnostic errors. So let's look at the possible errors. What can be the diagnostic error could be? So actually the failure to establish an accurate and timely diagnosis, which is basically an explanation which we are not able to convey to the patients about their health problems in the right time, which can maybe due to a delayed or incorrect or a misdiagnosis that has happened, and also the ambiguity that we have around when we actually look at the failure to communicate and failure to inform the patients, or failure to take the right decision at the right time, leads to those diagnostic errors. And diagnostic errors accounts to a huge fraction of the patient's healthcare safety, as we have already noted down, and also it represents the most important aspect of the cause of the major harms that happen in our hospitals. And every day, when we look at the diagnostic processes, there are always a chance that there is a error that can rise up. There are times when these errors are reported. There are times when these errors are just ignored and left at the mercy of the patient's life, where it has not been addressed even. So we have to really look at there is somebody who is getting affected when these diagnostic errors are not being addressed or not being identified and not being taken care of appropriately. So when we said 16% of the preventable diagnostic harms are mostly related to, globally are related to diagnostic errors, the Organization of Economic Cooperation and Development has also estimated that the diagnostic errors in chronic illness treatments represent around 5% of the total healthcare expenditure. So to look at a few of such examples, let us look at some of the examples here, which talks about a routine mammography. Patient has come with a routine mammography, and the patient shows abnormal results, and they were found that later on that it could have been a cancer, but since there was no proper investigation or proper follow-up, it led to a diagnostic error, and the patient had to suffer because of that. The failure to listen to the patient. The patient had a concern which is related to baby's development in the pediatric, and they concerned about anxiety. The child was diagnosed with a genetic disorder, and this was also probably not identified during their investigations. When we look at about the patient was in 50s, patient was in 40s, and the patient had abnormal shortness of breath. This was basically attributed to anxiety, but it ultimately led to myocardial infarction. This was again preventable, but it was not diagnosed appropriately. So this, the patient this is similar to the case is the patient had come with indigestion and fatigued, and the diagnosis was considered as acid reflux, but ultimately what was identified was, not identified was myocardial infarction. So what was the impact? The delayed treatment, the potentially the patient led to heart damage or death. And what was the problem here? The problem here was basically, the reason was that there was a similarity of symptom in this case as well. When we look at another case where the patient had a misdiagnosis of lung cancer versus pneumonia, the symptom was the patient had come with a persistent cough and chest pain, diagnosed with pneumonia, but the further imaging was not done, and the impact was that the patient treatment got delayed and patient had cancer, and potentially it allowed, basically the prolonged diagnosis made the patient suffer a lot, and this was due to the cognitive bias anchoring to an initial diagnosis, finally leading to a delayed diagnosis, and patient had to ultimately suffer because of that. A delayed diagnosis again, which talks about a gastrointestinal cause, where the patient had a chest pain, patient had a irritable bowel syndrome without a proper investigation, and the impact was the patient had continued to take gluten, worsening symptoms and potential complications. And the case that we are talking about here is the simple example of the diagnostic error, where the patient was not diagnosed appropriately, and the investigations were delayed persistently. The other case was related to a female who had a vertigo, who was, the stroke was misconsidered as vertigo, and ultimately the patient also had to suffer a lot, and the patient had lost the potential chance of survival or a treatment which could have been otherwise saved the patient's life. So these are the certain examples which talks about very consistently about the errors that has led the patient's life to the greater extent. So what are the aspects that we can now look at that we can prevent these errors from happening, or we can address these errors in our day-to-day operational front? So when we look at our multidisciplinary approach towards the diagnostic safety, from the healthcare leader's perspective, the first thing comes about is the culture of safety. The next is related to standardization and guidelines of basically standard treatment guidelines that we need to put across. We talk about the use of latest diagnostic technologies that we are trying to invest upon, and also the clinical decision support system that can help us a lot. Then fostering accountability and reporting, as we talked about that we should have a proper mechanism of reporting system. And we talk about research and innovations. Here in research and innovations, we have to look at the latest technologies and latest updated information on the latest diagnostic tools that is available, and we make use of it. Then the patient involvement. As we have all discussed in the previous discussion also, that patient involvement is very, very important, because they give a brief preliminary information about what could go wrong and what could be the potential chance of a diagnostic error, because they primarily give a lot of information about what are the symptoms they are facing, what are the issues which they are facing, which otherwise we miss when we do not have a proper communication with them. So we'll go to each one of the point one by one. The culture of safety, as we spoke about. As we spoke about the culture of safety, the leadership should involve the just culture, which talks about a open system wherein a free dialogue related to any errors, any near misses can be spoken upfront, and there should be no kind of any I would say penalization or any kind of threat or fear regarding discussion about any harm or any error. These errors should always be considered as a potential for learning, and also a scope for improvement, and also to bring in a systemic correction in the process. So as we spoke about this particular culture of safety, I would just want to quote about one example that we have started in Apollo, that we have started a tiered hurdle process, a daily tiered hurdle process which talks about mostly about the unanticipated deaths, the post-procedural deaths, the codes that we have, the emergency codes, the rapid responses, the return to ICUs, readmissions, any medication errors that leads to any escalation of care, further escalation of care, any patient-related or staff-related injuries that has happened otherwise which is not listed in the list. And on a daily basis, when we talk about it, every hospital that we have in the group, we discuss about those errors without any fear. And when the action or when an RCA has been done, the RCA talks mostly about the root cause of what could have been done to prevent those errors, and it should not be limited only to the person or the staff who is committing the error, but a systemic correction that can be done over the period of time and across the group to prevent those errors. So to avoid those errors from reoccurring, there are some advisories which are also being released from the corporate, so that these advisories are being taken into cognizance, and these become our guidelines to prevent those errors happening in the future. And there should be regular training, and there should be regular team building activities also to prevent those kind of, to create those kind of just culture approach or a culture of safety approach. And the second part is related to the establishment of standard guidelines and practices. So when we spoke about the standardized guidelines and practices, we have to refer to all the guidelines which is available across the globe and pick up those guidelines which is the latest and which is most and also not create any kind of adverse event due to non-implementation or non-appropriate implementation of these guidelines. So these, and also we also talk about the latest technology that we want to put across. The diagnostic technology is also based on the latest advances which is available in the country or in the worldwide. That needs to be looked into, and that needs to be implemented in the facility. And so when we talk about the future of technology, which talks about the integration, the use about the decision support system, the guidelines, the EMRs, the integration, and also become very important in our day-to-day life, because we have to adapt them, we have to understand its criticalities, we have to understand how it prevents the harm from happening, and also we also have to understand whether how it is impactful to prevent any harms for the patients. Then we talk about the accountability and reporting system. So when we talk about reporting system, we have to ensure that we empower everybody in the facility, that they can raise any concerns, any issues, anything related to staff safety or patient safety, irrespective of their names being known. Basically, there should be a possibility or option available to report anonymous reports also, because sometimes there is a threat which the staff may not be able to speak up, or may not be able to come up in the limelight saying that this error has happened due to me or due to this person, because there's always a fear, there's always a kind of stigma that probably the management will not accept this or something would happen to them. So those kind of fear should be avoided, and anonymous reporting should be encouraged, and this reporting should also be used for critical analysis and also identifying what are the trends which is coming across and what needs to be done to prevent or correct it at a systemic level, and see that these are not repeated again in the future in the hospital premises. Encouraging research and innovation. So as I said, there should be a lot of research activities should go on. There should be innovations that should be involved, so that these errors should not be when we see these errors coming up from the diagnostic front, we should be able to see that these errors should not be repeated. This should be it should not be repeated, and they should not be occurring at all, because when we put up systems in place, when we have staff accountable for driving this particular process, they should be able to touch upon every end-to-end process to see that every process has been complied with and compliance to every system and process has been looked upon. The most important part is basically patient involvement that we all have spoken about. When the patients are involved in the care delivery process, when the patients are being signed, they sign on the care pathway, care plan. When they sign on the investigations that they are being asked for, when they know why the investigations are being asked for, when they know why a particular medication has been given to them, when they know what is expected out of this particular treatment, they would help us to prevent more harms, and they would also be able to bring in a culture wherein a participative or a kind of team approach care would be provided to them, and their outcomes will definitely be better than what is happening now. Empower the patients. So when we say that empowering the patient, we have a system when we talk about the feedback mechanism, when we talk about that patient's delight is very important in nowadays. These are certain tools that we're using in our hospitals to ensure that the patients are being given appropriate support, and also they are being given enough freedom to speak up for their care in our facilities. So just to conclude, we should, for a multidisciplinary approach that we require to prevent any diagnostic harms, first of all, we have to have a just culture in place. Second is we should have the systems and processes in place, the guidelines and the standards should be available. Then we should look at the availability of the technologies. Then we should also look at the involvement of the patients and the families. And healthcare leaders, they definitely improve the diagnostic accuracy and timeliness by adopting all of these systems in place. Then the last but not the least, the education, the technology and the culture plays a very important role, and we should also be able to invest on the advanced diagnostic safety standards. Thank you so much for your patient hearing, and I'm sure I would be able to contribute a bit related to the patient safety in diagnostic areas. Thanks a lot.